Esta mañana tenemos con nosotros a Celeste Fisher, ella es la persona de gerente regional de Senior Life, y vamos a estar hablando con ella para ver qué es Senior Life. Good morning, Celeste. And we have Celeste Fisher with us, which is Regional Development Manager of Senior Life. Celeste, tell us a bit about what is Senior Life.
Senior Life is an innovative program that uses a team approach to provide seniors with medical, social, and nutritional and rehabilitation services. These services are provided at the Senior Life York Center, and they're accompanied with in-home personal care and other home care services as needed. Plus, Senior Life members are transported to and from the center for all medical appointments. Senior Life makes it possible for seniors to remain in their home, enjoying the comfort and reassurance of familiar surroundings while receiving the care that they need. The program is funded by Medicare and Medicaid. For seniors who meet the qualifications, all of these services provided at no cost, no copays, no premiums for medicine, physicians, specialists, or insurance premiums. Most seniors qualify and don't even know it. I encourage all the seniors out there in York County to call in and speak to an outreach coordinator to see if they qualify for services.
Celeste, I'm going to do a brief recap in Spanish. Senior Life básicamente es una entidad que provee servicios médicos y también servicios sociales para personas mayores de edad en el área de York County, y además ellos recogen a las personas para que las personas puedan ir a al centro de Senior Life para recibir los servicios sociales y también los servicios médicos. Celeste, you talked about transportation. Anybody that is eligible for Senior Life services, regardless of where they live in York County, can get transportation?
I'm sorry, regardless of?
Of where they live in York County.
We provide services to all of York County.
Okay.
So transportation to and from medical appointments and to and from the Life Center would be provided for anybody that meets the eligibility criteria.
Okay, pues lo que dice Celeste es que no importa dónde usted viva en York County, si usted es elegible para los servicios de Senior Life, va a recibir transportación, no importa a dónde usted viva. Celeste, one thing, are all at the Senior Life Center, are medical services provided there, like doctors and things like that, or that's at other facilities?
Yes. Let me talk a little bit. I'll break the services down
okay.
for you. Senior Life York provides a full array of health, personal, and social services 24 hours a day, 7 days a week, 365 days a year. Everyone that comes into the program receives their own nurse. We have a nurse that's on call 24 hours a day, and anytime, day or night. If our members have a concern, they can simply call and talk to the nurse. As a part of the Senior Life enrollment process, a team of geriatric doctors, nurses, social workers, and rehabilitation specialists, nutritionists, and other healthcare professionals will assess the members' individual needs. So everyone that comes into the program is treated as an individual, and the services that are provided to them are also individualized. Based on that assessment and in collaboration with the member and the family, we have a team approach. So the team creates an individualized care plan for each person based on their specific medical needs. Home care services are also based on members' individual needs and care plans. You know, the goal to this program is to maximize independence and to improve the quality of life for all of our members.
Let me give let me give a brief recap on that, so I will make sure I don't lose the essence of that. Básicamente, otra vez, Senior Life es un programa que provee servicios sociales, de salud y servicios médicos. Básicamente, cuando una persona es elegible, se le hace un plan para esa persona para las 24 horas del día. Es decir, no tienen que ir a Senior Life las 24 horas del día, pero se le asigna usualmente una nursa para que esa persona, el cliente, el paciente, pueda tener acceso a esa persona por si acaso tienen la persona o la familia tiene alguna preocupación, pueden estar en contacto con esta NORSA para tratar de ayudarle remediar alguna situación que sientan ese día, esa noche. Senior Life básicamente está ahí para proveerle al individuo y la familia el mejor cuidado necesario para evitar que esa persona tenga que ir a vivir en un tipo de institución que no sea su casa. Por eso es parte del esfuerzo del Senior Life. Celeste?
Yes.
One of the key things that we see in not only Pennsylvania but all around the U.S. is that a lot of folks, they get very ill, their family can't take care of them, they end up in an assisted living or nursing home. What does that do to an individual who's been used to being in their home all their life, and now are facing that type of scenario? What are some of the things that go through someone's head when they're faced with that decision?
I'm sorry. What are some of the things that they face? Well, just so you can understand that most people cherish the comfort of their families and their surroundings, being close to their family and friends, and being in charge of their own lives. Research shows that folks that remain in the community, and that's part of our mission in the LIFE program, is that when they remain in the community, they live longer and they're happier. Our program really looks at the quality of life and being able to take care of these seniors that are declining. Often seniors and caregivers think that aging and declining health conditions mean that they have to move to a nursing home, and that's inevitable. However, seniors do have the option to have them receive the care that they need, remain in their home, and give their families peace of mind. And the LIFE program is one such option that allows folks to do that. Senior Life is a part of a national program, and the national program is called PACE, which stands for Program of All-Inclusive Care for the Elderly. In Pennsylvania, the program's called LIFE, Living Independently for the Elderly. It's the only program of its kind. We use the word life in Pennsylvania because we don't want to confuse
there's
seniors.
The drug program PACE for seniors.
Right.
Yeah.
But, our mission is to partner with members and family and community and allow these folks to stay in their home while preserving their dignity, their autonomy. The way that we do things is member-centered. It's a team approach. It's advanced care planning. It's a shared decision process, and it's working with families. Open lines of communication is what our program is all about, to find innovative and creative ways for folks to remain in their home.
Let me give a recap in Spanish on that. Una de las cosas que dice Celeste es que, y la pregunta que le hice es que hay muchas personas cuando llegan a cierta edad y tienen ciertas condiciones que básicamente una única alternativa para muchas de estas personas es de ir a un asilo de personas ya mayores de edad. Este programa básicamente fue creado con el propósito de que la persona, ya que ha estado casi toda su vida en su propio hogar con su familia, pueda quedarse en su hogar pero al mismo tiempo recibir cuidado y tratamiento médico las 24 horas si es necesaria, pero dentro de su hogar y todavía viviendo en su hogar. Y esto es parte de un movimiento a nivel nacional de los Estados Unidos, donde se sabe que la persona que queda en su casa, queda con su familia, vive más tiempo y queda más saludable. Por eso este programa de Senior Life es importante y es una alternativa que muchas personas tienen para poder lidiar con estas situaciones, ya que uno está envejeciendo, pero que no necesariamente tiene que dejar su hogar y dejar su familia y puede residir ahí. Y por eso existe programas como Senior Life de York. Celeste, one thing, if people are interested in this program in Senior Life, number one, what is a phone number, and what type of information, if a family member or an individual calls, should they have at hand when they call your office?
Okay, well, the number at the center is 717-757-5433. And to be eligible for the program at no cost, and actually 98% of the seniors, of Senior Life members receive services at no cost. So to be eligible for the program at no cost, members must be at least 55 years of age or older, live in York County, be able to live safely in the community, be determined as medically eligible based on health conditions, and be determined as financially eligible based on incomes and assets. The LIFE program is funded by Medicare and Medicaid, and for seniors who meet these qualifications, all of these services are provided at no cost. There's no co-pays, no premiums for medications, to see physicians, specialists of any kind. I encourage folks to give Senior Life a call. One of the outreach staff there can help determine if you're eligible for the LIFE program. Again, you can call directly to the center at 717-757-5433. And I did want to let you know that we were talking about this being a national program, and the outcomes of this program nationwide are amazing. Participants are more likely to maintain their physical function that are in our program. One of the greatest services that we have is therapy, and those are ongoing services. So that feeds into the national outcome of being able to maintain physical function. Participants have lower rates of nursing home admissions and spend fewer days in the hospital if you're a member of Senior Life. And the big one is within the first 12 months of enrollment in a LIFE program or a PACE program nationwide, mortality is decreased by 32%. To me, that's amazing, and that is a national outcome. Participants overall report improvement in the quality of their health and the quality of life that they're receiving. We are having a open house on May 25th, and I invite seniors and caregivers who are interested in care for their loved one and want them to remain in the community to come out. It is from 11 to 2:30. Please call ahead to reserve your spot. It includes lunch, tour, and an activity. Come out and see the quality programming and the exceptional care that you can receive through the LIFE program. And, York County is really lucky to have access to the LIFE program.
One of the I wanted to ask you for this event on May 25th.
Mm-hmm.
Can family members also sign up to take the tour?
Absolutely. So any senior, or family members are invited to tour. There will be folks there. Their outreach coordinators will discuss eligibility and help connect the seniors' needs and the caregivers' needs with the services, and help to start the individualized plan for them to become a member of Senior Life.
Let me give a recap of this, what you just mentioned in Spanish. Primeramente, una cosa que quería enfatizar, Celeste, es que la data comprueba que después de un año de una persona participar en un programa de Senior Life, básicamente su salud mejora y también la tasa de mortalidad mejora también para esas personas que están, la mayoría de las personas que están participando. Para ser elegible, la persona obviamente tiene que ser un residente del condado de York, 55 años o más, vivir básicamente sin ningún tipo de incapacidad que no lo permita moverse. Y la persona tiene que ser elegible para Medicaid y Medicare. Y el teléfono para llamar, si es elegible, es el 717-757-5033. 717-757-5023. Y el día 25 de mayo van a tener una actividad de 11 a 2 y media para las personas que quieren estar para saber más sobre Senior Life y quieren ver el lugar. Pueden llamar también al 717-757-5033 y eso puede ir la persona interesada o familiares. Día 25 de mayo de 11 a 2 y media. Celeste, anything else before we leave?
That's all.
Okay. Well, we've been talking to Celeste Fisher, Regional Development Manager with Senior Life in York. Hemos estado hablando con Celeste Fisher, la gerente regional de Senior Life. Celeste, thank you for being with us, and
Thank you.
and have a great day.
You too as well.